Hi, my name is Dr. Erin Danielle with Rejuvenate-Life.com. It's important what you do with your dash. Today, I'm just giving a little update on the chicken wing. So my PICC line is out. So that is all antibiotics I had for 6 weeks. So for the joint sepsis that I had experienced, as a result, somehow after the first surgery, I had a second surgery, cleaned up a bunch of scar tissue. I discovered that I had the infection, and then had a 4-day hospital stay, had a PICC line put in, had antibiotics I needed to give myself every day. This is an infection that part of the body doesn't usually see, okay? We don't usually have 2 skin bacteria inside of a joint, okay? So it's not like a virus or something where it would go inside your orifices and have some normal immune responses that could kick that out, okay? This came in a foreign way. It needed some additional help. So I am now 1 week post antibiotic. There is no way to tell if this infection is fully gone. Okay, so that's the fun news, right? Who analytical minded, or really doesn't like that? Me, which is of course the lesson in it. So I have 2 weeks, right? After this, I'm in week 1 of week 2. And if I start getting my shoulder to lock up, etc., then likely the infection is still present. So far, I've been able to increase my range of motion. I am starting to do more weight-bearing activities with my hands, like some work on all fours, etc. So things are improving. They are getting better. And there's no evidence as of this point that the infection is still present. So fingers crossed, prayers, all of that welcomed, that it just continues to heal. I am on a medication, an NSAID that is also supposed to help. It's been known to help break up the scar tissue. So I have that for 2 more weeks as well, to try to get as much function back as possible. But, and I had a patient, actually, this was something that she had pointed out to me about the situation, because I've had to communicate, right, what's going on with my patients, so they know why I'm like all of a sudden doing things differently. But she said, you worked so long on all your physical toughness, right? And she said, you've done work with your mental toughness, and this was just, right, another opportunity to really gain more mental strength. And this is where one of the most recent videos that I also published was talking about basketball games and people's worthiness and all of that. And I said I've had a lot of my identity based on strength, and so I literally had a 15-pound limit with one arm. I literally had to have someone help me in Costco lift a 50-pound bag of salt onto my cart, because not because I couldn't, but because my left shoulder couldn't take all of it at that time, and the right shoulder could only help with 15 pounds. So I was very good. I'm like, oh shoot, how am I going to get this thing into the trunk of my car? So fortunately, I was able to balance it. Like, I balanced the bag on my foot, and I lifted my foot up and dumped it in my minivan. So yes, my sexy mom mobile. And so it wasn't as high of a trunk to get it in, but I still had my leg strength. So when you are used to being independent, fiercely independent, in a lot of cases, and you are used to lifting anything, and you are used to being the one to be asked to help with something, it's a whole other mental game to have to ask for the help. So that can be a challenge, right? When you're not used to asking for help. So there have been many emotional ups and downs for all of this. Obviously, a joint that I was worried about potentially losing my arm, that affects my profession. And again, my identity, right, is tied into what it is that I do for a living, because it is so much of who I am. But it looks like everything's going to turn out fine. However, in that process, right, there is so much more that can define who I am and who you are than just that one thing. Like, everything that I do is about promoting mind, body, and spirit health, all of it, because it's all important. So there's never been a time where only the physical aspect of health and healing has been important to me. So it just gave me some more time to start brainstorming some other ideas for things. So I will have some things coming out more on the mental, mental, emotional side of things, things that have helped me as I've grown through many different health challenges. So those of you who don't know, the shoulder has not been my only problem, right? Physically in my life, I had 2 birth defects. I had a Chiari malformation and a tethered spinal cord. So I've had 2 neurosurgeries as well. I've had other surgeries that maybe I wouldn't have done had I known it's something different. Some of them yes, some of them no. But I've always been a person that says there's a time and a place for everything. Having birth defects that affected the quality of my life, I understand how important that is to have that balance. But that's my little update on my shoulder. And then as far as people who are going through this, health challenges and other things, I first and foremost tell people it's okay to be sad. And you might have to feel the sad. So I had to allow myself to feel the sad. And for someone who likes to stay busy, and one of my coping things that I do is I like to be helpful. I like to do nice things for other people. I like to focus my attention on something that is positive versus stuff that, I can't control. I can't control how fast the shoulder heals, but I can control if I want to make something for someone, if I want to bake something, if I want to, volunteer for something or what have you within my restriction parameters. So there's different things we can do. I can still choose to be nice to people. I can still choose to be happy and smiling. I can choose lots of things. So if you've been with me on this journey and you've had any depth of everything with this whole shoulder, it's for those of you going through it, it's not easy. And there are changes and there are challenges and there are things, but there is a silver lining somewhere, right? We get out of the storm. We'll get into another one, but that's just how life goes. So in the process of healing, in the process of life, we have suffering. It just is. But we can enjoy the calm. We can enjoy anything that, we can still find joy even while we're suffering. There's still something to be thankful and grateful for. So anyway, that's my update with my shoulder. So far, so good. We're still doing pretty well as far as healing and recovery are concerned. So I am starting more strengthening process with the shoulder. So I'm really thinking that we could have a full recovery at some point. But the last little bit of motion and things are just taking a while. So again, I'm Dr. Erin Daniel with Rejuvenate-Life.com. It's important what you do with your dash.